Have you ever wondered why some medications are specifically prescribed to be taken just once a day? It's not a mere coincidence, but rather a careful consideration of various factors that impact both the effectiveness and safety of the treatment. In the realm of modern medicine, ensuring the safe and effective use of medications is paramount. For many drugs, the dosing schedule plays a pivotal role in achieving this balance. In the United States, healthcare providers often recommend medications that are taken once a day to avoid toxicity while maximizing therapeutic benefits. These medications are carefully selected based on their efficacy, safety profiles, and pharmacokinetics. In today's video, we will delve into the top 10 such medications. Disclaimer: please be aware that the content presented in this video is meant solely for educational purposes. It should not be considered a replacement for expert medical advice, diagnosis, or treatment. Whenever you have inquiries related to a medical condition, it is crucial to consult a qualified healthcare professional. Please do not disregard professional medical advice or postpone in seeking it based on information you have come across in this video. Exceeding the prescribed frequency of medication can disrupt the carefully balanced pharmacokinetics of the drug. Medications are typically formulated and tested for their safety and efficacy based on specific dosing schedules. Altering this schedule by taking them more frequently than recommended can lead to unpredictable variations in drug concentrations in the bloodstream, potentially rendering the treatment less effective or conversely causing an accumulation of the drug that could lead to harmful side effects or toxicity. Furthermore, many medications are processed and eliminated by the body at a particular rate, which aligns with their recommended dosing interval. Taking them more frequently can overload the body's capacity to metabolize and excrete the drug properly, potentially resulting in a buildup of the medication and increased risk of adverse reactions. Let's take a look at these medications that should only be taken once a day. Number 10. Lisinopril. Lisinopril is an angiotensin-converting enzymes inhibitor used to treat hypertension and heart failure. Its once-daily dosing regimen ensures consistent blood pressure control and minimizes adverse effects. A study published in the New England Journal of Medicine found that once-daily dosing of lisinopril effectively reduced blood pressure in hypertensive patients. The recommended adult dosage typically ranges from 10 to 40 milligrams per day, usually taken as a single daily dose. It can be taken with or without food, but maintaining a consistent schedule is essential. Common side effects may include dizziness, dry cough, and elevated blood potassium levels. Number 9. Atorvastatin. Atorvastatin is a statin used to lower cholesterol levels and reduce the risk of cardiovascular events. Once daily dosing is employed to maintain stable lipid-lowering effects and minimize liver enzyme elevations. The Jupiter trial demonstrated the efficacy of atorvastatin in reducing the risk of heart attacks and strokes. The recommended adult dosage typically ranges from 10 to 80 milligrams per day, typically taken as a single dose. It can be taken with or without food, but it's important to take it at the same time each day. Potential side effects include muscle pain, liver enzyme elevation, and gastrointestinal symptoms. Number 8. Escitalopram. Escitalopram is a selective serotonin reuptake inhibitor used to treat depression and anxiety disorders. Its once-daily dosing regimen helps maintain steady blood levels and reduce the risk of withdrawal symptoms. Multiple studies have demonstrated the efficacy of escitalopram in improving symptoms of depression and anxiety. The normal adult dosage is 10 milligrams per day, taken as a single dose. It can be taken with or without food, preferably in the morning. Common side effects include nausea, insomnia, and sexual dysfunction. Number 7. Rivaroxaban. Rivaroxaban is an oral anticoagulant used to prevent blood clots and strokes in patients with atrial fibrillation and deep vein thrombosis. Once daily dosing ensures consistent anticoagulant effects and simplifies patient adherence. The Rocket AF trial demonstrated the non-inferiority of rivaroxaban compared to warfarin in preventing strokes in atrial fibrillation patients. The normal adult dosage is 20 milligrams per day, taken with the evening meal. Swallowing the tablet whole with food enhances absorption. Common side effects include bleeding and gastrointestinal discomfort. Number 6. Metformin. Metformin is an oral medication used to manage type 2 diabetes by improving insulin sensitivity and reducing glucose production in the liver. Once daily dosing helps control blood sugar levels throughout the day and minimizes gastrointestinal side effects. The UK Prospective Diabetes study showed that metformin reduced the risk of diabetes-related complications. The normal adult dosage typically ranges from 500 to 2,000 milligrams per day, which can be taken once daily or divided into 2 doses. It should be taken with meals to reduce stomach upset. Common side effects include diarrhea and abdominal discomfort, especially when starting the medication. Number 5. Vitamin D. Vitamin D is a fat-soluble vitamin essential for bone health, immune function, and overall well-being. Daily dosing helps maintain adequate vitamin D levels in the body and supports its various functions. Numerous studies have shown the importance of vitamin D in maintaining bone health and preventing deficiency-related conditions. The normal adult dosage typically ranges from 1,000 to 2,000 IU per day. Although individual needs may vary, it should be taken with a meal for better absorption. Daily dosing is recommended, and side effects are rare when taken within the recommended doses, but excessive intake can lead to toxicity. Should you have any inquiries regarding your medication, we crafted a dedicated book for your benefit. 10 questions everyone should ask their pharmacist. You can find the link in the description below. Feel free to explore it. Number 4. Levothyroxine. Levothyroxine is a synthetic thyroid hormone used to treat hypothyroidism. Once daily dosing ensures consistent thyroid hormone levels in the body. Clinical studies have consistently shown the efficacy of levothyroxine in managing hypothyroidism. The dosage varies depending on individual needs and is determined by a healthcare provider. It should be taken on an empty stomach in the morning to maximize absorption. Common side effects are rare when the medication is used appropriately but can include symptoms of hyperthyroidism if the dosage is too high. Number 3. Risedronate. Risedronate is a bisphosphonate medication used to treat and prevent osteoporosis in postmenopausal women and certain other conditions. Once daily dosing simplifies administration and reduces the risk of esophageal irritation. Clinical trials have demonstrated risedronate's ability to increase bone density and reduce fracture risk. The normal adult dosage typically ranges from 35 milligrams per day or 150 milligrams once a month, as determined by a healthcare provider. It should be taken in the morning with a full glass of water, at least 30 minutes before eating or drinking. Potential side effects include gastrointestinal symptoms and rare cases of osteonecrosis of the jaw. Number 2. Tenofovir emtricitabine. Tenofovir emtricitabine is a combination medication used for pre-exposed prophylaxis to prevent HIV infection. Once daily dosing enhances adherence to PrEP regimens. The IPREX trial showed that daily use of tenofovir emtricitabine reduced the risk of HIV infection in high-risk population. The normal adult dosage is 1 tablet per day. It can be taken with or without food at the same time each day. Common side effects include nausea and headache, while rare but serious side effects include kidney and bone issues. Number 1. Aripiprazole. Aripiprazole is an atypical antipsychotic medication used to treat various psychiatric conditions, including schizophrenia and bipolar disorder. Once daily dosing simplifies medication management and promotes patient adherence. Numerous studies have demonstrated the efficacy of aripiprazole in managing symptoms of schizophrenia and bipolar disorder. The normal adult dosage varies depending on the condition being treated and should be determined by a healthcare provider. It can be taken with or without food at the same time each day. Common side effects include weight gain and akathisia, while other potential side effects depend on the specific condition being treated. Once daily medications play a crucial role in modern healthcare by simplifying dosing regimens, promoting patient adherence, and reducing the risk of toxicity. The top 10 medications highlighted in this video offer a diverse range of therapeutic benefits, from managing chronic diseases to preventing life-threatening conditions. However, it's important to note that individual responses to medications can vary, and healthcare providers should always determine the appropriate dosage and frequency based on a patient's specific needs and medical history. Additionally, regular follow-up and monitoring are essential to ensure the safe and effective use of these medications while minimizing the risk of adverse effects. Always consult with a healthcare professional for personalized guidance on medication use and potential side effects. Now, a quick question to you, our dear viewers. Can you name a medication that you or someone you know takes once a day? Let us know down below in the comments. For a more comprehensive understanding of this topic, please see the description box. We provide a list of the top 10 questions to ask your pharmacist when picking up your medication. This is not an all-inclusive list, and if you need more information, check out the link below. Welcome to Dr. Vivian Medications and Natural Supplements. Our channel is dedicated to providing valuable information on health and wellness that's made by a licensed professional. Times are crazy, and it's extremely important to be well-informed and taking care of yourself. If you enjoyed watching, please help us out by liking this video. In this way, we will know how well we're doing. And if you like more of these, consider subscribing and hit the bell notification to stay on top of more upcoming videos. Thanks for watching.